Good morning to all. I am Prof.Manavalam. Now we are going to see about the non-invasive procedure that is used during the time of pregnancy in order to identify the fetal heart rate abnormalities. In that, we are using the cardiotocography. It is one kind of machine to monitor the fetal heart rate according to the uterine contraction experienced by the mother. This is a series of cardiotocography we are going to see in this video. Already we have seen the introductory sessions about the cardiotocography in cardiotocography part 1. Now we are going to see about the cardiotocography part 2. That what are the things in the second part we are going to see about means we are going to see about the baseline fetal heart rate. What is the variability of fetal heart rate? So if any changes occurs in the baseline fetal heart rate means what will be happening to the fetus? It is called as a classified into fetal bradycardia and fetal tachycardia. So all of things we are going to see in this part 2. First we will see about the baseline fetal heart rate. So baseline fetal heart rate, this is the graph sheet example I have given. Like this only the sheet which will be coming out from the cardiotocography machine. In that we are always taking a 10 minutes window period. 10 minutes how they are calculating means in this graph we will see the vertical line, two vertical lines are there in between the horizontal line. So in that vertical line they have given the measurements. It is indicating the fetal heart rate. So from one measurement to another measurement, in between the 10 lines are there. Each one box is 10 box are there. Each box is indicating to 1 minute or calculated as a 1 minute. So that's why it is called as a 10-minute window. In this 10-minute window, the average fetal heart rate, how much it will be getting enter, that is called as a baseline fetal heart rate. So the normal fetal heart rate, baseline fetal heart rate is between 110 to 160 beats per minute. So this is already we seen what is baseline fetal heart rate. Sometimes there is a variation in the fetal basic heart rate. Sometimes it may goes beyond the level of 160 beats per minute. So then it is called as a fetal tachycardia. There are many reasons are there for fetal tachycardia. The first reason is or cause is fetal hypoxia. Whenever the fetus doesn't get the adequate amount of blood supply, automatically the oxygen storage and oxygenation of the fetus which will be gets down. So automatically the fetus develop the hypoxia. That is the reason that there is a variation or changes in the fetal heart rate. Next, thyroidism, specifically the hyperthyroidism that is affected to the mother means automatically it will be affecting the fetus. Next, fetal tachyarrhythmia. Next, any infectious or microorganisms that cause infection to the amniotic cavity, that is called as a chorioamnitis. That also one of the reasons of fetal tachycardia. Next, if fetus or maternal affected by anemia, the hemoglobin level that will be getting reduced from the normal level means then it is called as anemia. So either fetus or mother is affected by anemia means definitely there is a variation in the fetal heart rate that is called as a fetal tachycardia. Next, move on to the fetal bradycardia. So fetal bradycardia, it is defined as the baseline fetal heart rate. It is goes below the 110 beats per minute. Sometimes it may lies between 100 to 120 beats per minute. In some of the situation, we will see in which all the situation it lies between the fetal heart rate lies between 100 to 120 beats per minute. First one is the post-date gestation. Post-date gestation means it is nothing. The normal term is called as a pregnancy is called as a 37 weeks to 42 weeks. If it is going beyond that 42 weeks means then it is called as a post-date gestation. In that condition there is a chance of fetal bradycardia. Next, accipito posterior. It is one type of malposition. So instead of the head is presenting into the anterior part of the pelvis, if it is present in the posterior part of the pelvis means there is a chance of fetal bradycardia. Next, if it is the presentation is not a normal presentation. So if it is transverse presentation means there is a chance of fetal bradycardia. Apart from that, in some of the condition there may be a severe prolonged bradycardia. In that condition, the fetal heart rate goes below or less than 80 beats per minute for more than 3 minutes period of time. The main reason is fetal hypoxia. Next we will see the reason for prolonged and severe bradycardia. The first one is prolonged cord compression. It is happening when the fetus comes down at the time of labor. Usually the fetal head it will be descend down. So while it is descending down, it will be compressing the umbilical cord. Normally it is happening. So prolonged period of time it will be the fetal head is compressing the cord means there is a changes in the fetal heart rate. Next, prolapse. The umbilical cord, it is getting prolapse. It is come out into the vaginal intritus, outside of the vaginal intritus. Then it is called as a cord prolapse. Next, maternal seizures. If the mother, because of uncontrolled blood pressure, sometimes the mother end up with a seizure. So mother develop with seizure. In that condition there is automatically the blood supply to the fetus it's reduced. So there is a variation of the fetal heart rate. Next, epidural and spinal anesthesia. Both the type of anesthesia they are commonly using during the time of, not very common the spinal one, but epidural commonly they are using during the time of normal pregnancy in order to reduce the pain that is experienced by the mother during the time of labor. But spinal anesthesia they are using, most probably they are using in case of cesarean section. In that condition, there is automatically changes in the maternal as well as fetal heart rate. Next, rapid fetal descent. Instead of comes a slow, actually this process which will be taking place in a slow in progress according to the stage wise. But instead of going according to the stage wise, sudden descent or rapid fetal descent which will present. Descent means nothing but it is coming down into the lower uterine cavity. The fetal head is coming down into the lower uterine cavity or it is enters into the pelvic brim. So in that condition there is a changes in the fetal heart rate. So that's all about the baseline changes, fetal tachycardia and bradycardia. Next we move on to the second parameters, that is baseline variability. Baseline variability means the same like the 10 minute window period they are taking and they are measuring the baseline variability. Actually the heart rate it will be not goes in the same level. There may be a changes there in between beats to beats. There is a variation is there in between beats to beats in the heart rate like a normal adult. The lub dub. So there is a variation. One lub dub the sounds that we are hearing. The same that is the heart rate we can hear it like that. There is a variation between each beats, that is called as a baseline variability. This baseline variability it is mainly depends upon the, or it is saying that there is a intact fetal nervous system. The baseline variability is happening because there is a proper functioning or coordination between the nervous system, central nervous system baroreceptor, chemoreceptors. So there is a good coordination between these systems. It leads to there is a changes in the fetal heart rate. That is called as a baseline variability. It is normal thing. It should be happen. It is normally it should be present to every fetus. Then only it is considered as a normal. So the baseline, no one having the heart rate in a same level. There must be a difference difference must be there between each beat. That is called as a variability. So actually normal variability is between 5 to 25 beats per minute. That is considered as a normal fetal variability. So normal variability, if it is present, means it is indicating that the fetus neurological system is intact. So the baseline variability, it is must for every fetus. Next, how we can interpret the variability. So it is divided into three categories. That is reassuring, non-reassuring, abnormal. Reassuring means the fetus is good and healthy, so there is no problem to the fetus. If in case of reassuring means the baseline variability must be 5 to 25 beats per minute between these two markings. Next, move on to the non-reassuring. There is a little complication the baby may have, so we have to give concentration on the baby. It is less than 5 beats per minute or between 30 to 50 minutes period of time, or more than 25 beats per minute for 15 to 25 minutes period of time means then it is considered as a non-reassuring. So the fetus is need some immediate concentration to save the life of the fetus. Next, move on to the abnormal. Abnormal, it indicates that it is completely abnormal. So the fetus having some severe type of problem. So immediately we have to give more concentration on the. So immediately we have to actively we have to manage the situation and we have to deliver the baby in order to save the life of the baby. So which are the condition is coming under abnormal means the baseline variability, it is less than 5 beats per minute for more than 50 minutes period of time, or more than 25 beats per minute for more than 25 minutes period of time, or it is sinusoidal pattern. Sinusoidal pattern means it is nothing but there is no variation, beat to beat variation of fetal heart rate. So it is without any changes, it is going between 110 to 120 like that. It is no changes that is occurring. The same like wave like structure if it is going on means that is called as a sinusoidal pattern. In next third series I will show you what is sinusoidal pattern. Next, which are all the condition the variability which will be getting reduced. First, fetal sleeping. Whenever the fetal falls asleep, automatically there is no variation. There is no variation in the fetal heart. Actually, the sleep cycle of the fetus, the cycle between the time period between the fetus sleep and waking period is 40 minutes. So the duration is 40 minutes. So whenever the baby is sleeping, the fetus is sleeping, that time we are putting the mother under cardiotocography. No one will get the proper variability. So we have to wait for the fetus to get wake up and we have to monitor the fetal heart rate. Or otherwise we have to use different types of stimuli are there. We have to use the tactile stimuli or we have to initiate the contraction, whatever it may be. So some of the things are there. We have to apply that measures in order to wake the baby up and we have to monitor the fetal heart rate if we needed any in emergency situation. And in case of fetal acidosis, it is occurring because of hypoxia, long period of hypoxia and fetal tachycardia. And if the mother had the drugs like opiates, benzodiazepine, methyl dopa and magnesium sulfate, for mothers, if the mother had some of the medical problems, or in order to reduce the pain perception level during the time of labor experienced by the mother used to have the doctors used to administer certain medication. These medication that automatically, it is most of this medication, it is like a tranquilizer, it is inducing some sleep, and also it is reduced the most of the organs level of functions. So automatically the cardiac function, it will be getting reduced. So the paternal blood supply to the fetus also getting reduced. Because of this, there is a changes or variation in the fetal heart rate. Next, prematurity. Prematurity, definitely there is a variability. Prematurity means the baby growth is not up to the term. Term means it is 37 weeks to 42 weeks of pregnancy. If it is lesser than that, extremely premature. If it is less than 28 weeks, means the fetal cardiac the organs, cardiac organs is under development. It is not fully working. So it is mainly depends upon the mothers. So say automatically it is not accommodating the changes whichever happening in the inside the womb. So automatically there is a variation in the fetal heart rate. So because of these reasons, there is a change, there is a reduced variability. I hope you understand about the what is baseline fetal heart rate and what is baseline variability, and also when in which are the condition the variability which will be getting reduced. Okay, thank you all. We will see in the next part of cardiotocography.